Good morning, ladies and gentlemen. Welcome. My name is João Breda, and I'm the head of Athens Quality of Care Office, the one where you are sitting today. And I would like you to take your seats and relax and get ready for this ceremony. Meanwhile, I pass the floor to our director, Natasha Azopardes.
Thank you, João. Good morning, Your Excellency, Prime Minister Kyriakos Mitsotakis, honorable ministers, dear WHO Regional Director, ladies and gentlemen. I am Natasha Azopardes, and I am the director of the Division of Country Health Policies and Systems within the Regional Office of WHO Europe, of which this office today here, Quality of Care, is one of the most important units in this division. And it is really an honor to welcome you to this inauguration of the new premises of our office, and also to join us in the launch of a new WHO European program on quality of mental health services for children and adolescents in the European region, which is really groundbreaking and so timely. And now I would like to invite the Minister of Health of the Hellenic Republic, Mr. Atanacios Plebris, to deliver your opening address. Minister Plebris, the floor is yours. Please come to the podium.
Dear Prime Minister, Honorable WHO Regional Director for Europe, Dr. Hans Kluge, dear Ministers, dear colleagues and friends, ladies and gentlemen, it's a great pleasure to be here with you today, marking an important milestone for our collective health, not only in our country, but for the European region at large. It is with pride that I can stand before you and at the official inauguration of the WHO Athens Quality of Care Office. And it is an honor for Greece to be the country hosting this office. As we recover from COVID-19 pandemic, we find ourselves in a position of a great opportunity. This is an opportunity to prepare for the future resilience of our health systems. Our greatest priority is our health, and it is important that the quality of health services is placed at the heart of our agenda. Quality health systems require criteria and guidelines, and now Greece is in the position to provide support and host an office ready to embark on such a critical mission. The WHO Athens Quality of Care Office came at the time when country support became a necessary tool to combat future crises. And one of these crises relates to the mental health of our people, and we have now managed to launch the program for mental health for children. The Greek government, in close collaboration with the WHO Quality of Care Office, has prepared a new national action plan for quality of care and patient safety. And together with the National Organization for Quality Assurance in Health, ODP, and under the technical support of WHO, we will concentrate our efforts to developing this plan, which will lead to a national health service for 21st century. I would like to wish great success to everyone involved in making this day reality, and thank you very much for your attention.
Thank you very much, Honorable Minister, for your impactful remarks. And I'm really now truly delighted to invite the Honorable Minister of Development, Mr. Adonis Georgiadis, to take the floor. The floor is yours. Thank you.
Dear Prime Minister, I wish you health after the small adventure with COVID. Dear Ministers, dear colleagues and friends, ladies and gentlemen, especially Honorable WHO Regional Director for Europe, Dr. Hans Kluge. It is an honor to be with you today, marking an important milestone for the evolution of healthcare and the quality of healthcare services not only in Greece, but in the whole European region. I'm equally delighted to participate in the inauguration of the WHO Athens Quality of Care Office in Athens, an event that marks an honor and a great achievement for Greece as the host country, for an office created to bring such valuable change to the Mediterranean basin as well. I will never forget the day, the last day of my term in office of Minister of Health of the Hellenic Republic on the 9th of June of 2014, that I handed over the keys to Dr. Pavlos Theodorakis for the creation of the first WHO office in Greece, a pigeonhole of an office located on the 6th floor of the Ministry of Health's facilities in Athens. And I think of today as a testament to how far we have come, not only by expanding towards a country office, but with the development of a regional European office for quality of care with a complementary component on the quality of health services. This is a significant step in the evolution of our country and one that has made and will continue making such a positive difference to all countries receiving support from the office. We are now adapting our healthcare system to the needs of the 21st century. To bring this plan to fruition, we must invest in and finance a framework where our society can flourish, and this directly tied to quality of care, as quality of care is inextricably linked to quality of life. Investing in health is directly tied to wealth, as I like to say. To ensure our health systems are efficient, we must introduce adequate quality standards to track and improve them, so that they are efficient, effective, people-centered, and fair, so that our workforce is productive, and so that the role of health in sustainable economic development is highlighted. This is exactly what this office will strive to achieve, and achieve it they will. Today marks the start of a post-pandemic transformative era, and in my position as Minister of Development and Investment, it is my responsibility and personal endeavor to enable this transition. The Greek government and myself are ready to support my dear friend Hans Kluge on this pioneering journey. And I would like to take the opportunity to announce that the National Action Plan of Quality of Care, prepared in collaboration with WHO Europe, is right on track to be implemented, as Minister Plebris requested from our ministry. It is indeed a great honor for the Greek government and for myself to be able to work alongside WHO Europe and such a great set of colleagues to make all the necessary steps to emerge with a system that is more resilient, inclusive, and efficient. Health, after all, is an investment in human capital, an investment in our future society. I thank you all again, and my last comment will be, when I was named Minister of Health, I first went to Mr. Mitsotakis to give me advices because he was training for the Hellenic. He knew a lot about all these things. So I'm very proud, Mr. Prime Minister, that during your term in the office, this important event is being implemented. Big for Greece, big for Europe. Thank you.
Thank you very much, Honorable Minister Georgiades. I would now like to call upon Mr. Vasilis Kikilis, Minister of Tourism at the Hellenic Republic, to deliver his keynote speech. Dr. Kikilis, floor is yours.
Thank you very much to my friend, dear Prime Minister Mitsotakis, Honorable WHO Regional Director of Europe, Dr. Hans Kluge, personal friend. Dear ministers, colleagues, friends, ladies and gentlemen, I would like to open my speech by saying that standing here today is a moving and pivotal moment for me, not just as a Minister of Tourism of the Hellenic Republic, but as a person. The opening of WHO Athens Quality and Care Office is a statement to all that we have achieved the past 2 years, all that we have managed to overcome in our battle with COVID-19 pandemic. This ambitious undertaking began while I was in office as a Minister of Health exactly 1 year ago, in April 2021, in the midst of the devastating public health and humanitarian crisis. And the 2 years that we have served in that position undoubtedly represented the most critical period in our career so far, so allow me to channel all my efforts in helping our country to emerge from this emergency united and strong. I'm proud to see that our efforts are continuing through the important work of Minister Plebris and, of course, the unparalleled support, determination, and guidance of our Prime Minister Kyriakos Mitsotakis. I'm proud to say that our country faced this tremendous challenge and grasped the opportunity to not only battle the short-term deficits that we encountered, but to set the foundations for a long-term vision of quality healthcare, a vision that aims to reimagine the health sector and upgrade it to serve our current reality and the expectations of the future. So the office we are in the privileged position to inaugurate today serves as the amalgamation of all the lessons we have learned through our shortcomings and our successes. It will consolidate these efforts so that we emerge well equipped to cover the needs not only of the nation, but of all the countries in the WHO European region that the office is set to provide and it supports towards. Before I close, I would like to take this opportunity to make an important announcement. I'm delighted to be in the position to show the sustained collaboration between my office as a Minister of Tourism and the WHO, as just a few days ago in the meeting with Dr. Joao Breda and Dr. Pavlos Theodorakis, we began planning an innovative project for our country whose focus will be on the quality of health service provisions for tourists. So this plan aims to cover all aspects of health tourism, medical tourism, namely covering all those who visit our country for the purpose of receiving targeted intervention and treatment, wellness tourism, covering those who visit our country for the purpose of enhancing their personal well-being, but also everything in between, with locals and tourists alike enjoying access to quality health care, whether planned or not. Actually, it's a growth investment and health investment in the country. Our plans aim to solidify Greece as a tourist destination suited to cover all possible health needs, establishing presence as a health tourism hub in the whole of the European region. So the investments we make in the public health are undoubtedly, Mr. Minister, the ones with the greatest returns, and we have shown that time and time again. So I wish you all the best of luck and thank you, and a personal thanks to the Prime Minister who has supported and given the opportunity to serve in public health. Thank you very much.
Thank you very much, Minister Kikilias. And of course, we are delighted to see that you continue to pay a lot of attention to health and health services quality in your new role. And now I would like to invite the alternate minister, Mrs. Mina Gaga, to address the audience. Minister Gaga, the floor is yours.
Good morning, Honorable Regional Director, Dr. Kluge, Honorable Prime Minister, Mr. Mitsotakis, dear Ministers, Honorable Ministers, colleagues and friends. It is a great pleasure to have this office in Athens. We are very much involved in all WHO goals, be it universal health coverage, sustainable development in health, in mental health as well, in the lives of people, and we're delighted that we have this office here, that we can collaborate with the WHO. We give support to the WHO and support the WHO supports us in return. So I'm really happy. I really think that patients benefit from standard operating procedures, making sure that everything we offer the patients is in the right directions and what they need, fulfill their needs and their expectations. I'm really looking forward to working with the office and supporting the office and supporting other countries as well through Greece. Thank you, Prime Minister, for helping this. Thank you, Professor Dr. Kluge, for this. Thank you all for the office director, everyone here. Thank you.
Thank you. Thank you very much, Dr. Gaga, for your great support. I have now the pleasure to invite Madame Rapti to the podium to deliver her speech. The floor is yours. Thank you very much.
Your Excellency, Prime Minister Kyriakos Mitsotakis, Honorable Regional Director, Dr. Hans Kluge, dear Ministers, dear colleagues and friends, ladies and gentlemen. I am deeply honored to be here today inaugurating the WHO Athens Office for Quality of Care, an office I have had the privilege of working with from the first day I took up my post as Deputy Minister of Health, and in close collaboration with our Regional Director for Europe, Dr. Hans Kluge, Dr. Joao Breda, and Dr. Pavlos Theodorakis. I'm even more delighted to stand before you and speak from my own first-hand experience about all the visions we have jointly addressed with the office so far, a testament to the substantial change it can bring not only for Greece, but the 53 countries of the WHO European region, and to all the future actions we undoubtedly set forth to achieve. It is widely evident, and I know many of us can also attest to the fact that the COVID-19 pandemic and its consequences have posed a serious threat to the mental health and well-being of our societies at a global scale. The silver lining is, however, that it has shifted our focus to creating a framework that enables high-quality, integrated and people-centered mental health services for the general population with an emphasis towards vulnerable groups. A framework shaped to react with readiness both in times of crisis but also throughout a person's lifetime. We have jointly made concrete steps in assuming this responsibility and addressing deficits through key international initiatives such as the Athens Mental Health Summit in July 2021 and the declaration of which acted as the stepping stone for the WHO Pan-European Mental Health Coalition. And I'm proud to say, Dr. Kluge, that in my position as Deputy Minister of Health, I have overseen tremendous changes in the range, breadth and scope of mental health services all in the past 2 years. This would have not been able without the continuous support of our Prime Minister, Kyriakos Mitsotakis, as well as the Minister of Health and, of course, the technical guidance of the WHO. What brings me even greater joy is seeing the theoretical framework for the creation of this office to be put to the test from day one of its conception and the immediate expansion of its activities to support other countries in the region on the most pressing issue today, which is the mental health of children and adolescents. We have come so far in Greece alone that it is an honor and something we can be proud of that these achievements can be extended to assist other countries through our program, something I will further expand on in the second session of our meeting today. Before closing, I would like to make a symbolic announcement in the presence of our Prime Minister, Kyriakos Mitsotakis. We have seen and used excellent resources and careful planning to draft a new action plan that will change the way mental health is addressed across our nation. I would like to use this time to present the Prime Minister with the executive summary of the National Mental Health Action Plan, which contains pivotal actions to be taken towards achieving our goals in children and adolescent mental health, and which we are currently finalizing alongside with the WHO. Dear Prime Minister, I present you with our plan. Thank you very much for listening.
Thank you very much, Deputy Minister Rapti. And indeed, we commend you on having taken this work forward. This is very important, and we will continue as WHO to support you in the next steps. And now it is my pleasure to introduce our next speaker, our Regional Director for WHO Europe, Dr. Hans Kluge. Dr. Kluge, thank you also for making the time to be with us in spite of your hectic schedule at this important launch today.
Your Excellency, Prime Minister Mitsotakis, Honorable Minister Plebris, Honorable Minister Georgadis, Honorable Minister Kiklias, all my close friends, Alternate Minister Dr. Gaga and Deputy Minister Madame Rapti, ladies and gentlemen, Kalimera Sas. It is such an honor to be with you today in Athens, and Excellency Prime Minister was telling that this is his first public function now in public, so I cannot be more honored really as a WHO Regional Director for Health, because this is the proof that health is at the top of the political agenda in the country, which I am taking with me country after country, speaking to heads of government. This is my first visit to Greece of 2022, however, my fourth visit in the last 12 months. For many years, Greece has been a steadfast and vital partner for WHO in the European region. The office we are inaugurating here in Athens today is a concrete and highly visible expression of that partnership. Looking around me at these magnificently renovated facilities, I want to express my heartfelt thanks to you. Prime Minister Mitsotakis, I will start by thanking the government of the Hellenic Republic of Greece for its partnership and generosity. I know that improving the quality of healthcare in Greece has been a priority for your government. With your hosting of the Center of Excellence, the WHO Europe Quality of Care Office, Greece is positioned to lead improvements in the quality of care across the whole region. Minister of Health, Mr. Plebris, you and your predecessor, Dr. Kykelias, have been at the forefront of improving quality of care in Greece and adamant supporters of this office. I thank you so much for your unparalleled support and wise guidance. But the roots of this office go back a long way. I cannot overstress the long-standing collaboration and strong ties WHO has formed, WHO Europe, with the Greece Ministry of Health. These stretch back to 2013, and our engagement with Minister of Development and Investment, Mr. Adonis Georgiadis, who was then Minister of Health. Last, but by no means least, I want to thank Dr. Breda and his team of international experts, as well as my advisor for Greece, Dr. Theodorakis, who reminds me every single day how important Greece is for my mandate. And of course, also Dr. Natasha Azapardi-Mascat, our excellent Director of Country Health Policies and Systems. To each and all of you, I say, Efcharistopoli. The new facilities we inaugurate today are much needed to help the office deliver our future ambitions and make good on the promise of the European Programme of Work to prioritize mental health. But the WHO team here started its work in 2021, already delivered impressive results. It initiated technical collaboration with countries including, but not only, Albania, Malta, Montenegro, North Macedonia, the Republic of Moldova, and Tajikistan. It has established networks of partners, including individual scientists and experts, as well as institutions and centers. And it has decisively contributed to two highly impressive events in 2021, both of which were important contributions to our work in the whole European region. Number one, the Mental Health Summit in July. This reinforced the scope and foundation of the Pan-European Mental Health Coalition, and we had there the honor to have the Prime Minister himself, and in December, the meeting of minds on quality of care. But perhaps its biggest achievement is the new program we are here to launch today. And let me tell you how it started. In April 2021, when we held a startup event of the team, I was invited to meet Prime Minister Mitsotakis. I vividly recall being in your office, Excellency, in the Maximus mansion, when the Prime Minister said to me, quote, "Dear Hans, we should give priority to the mental health of our society, especially our children and adolescents," unquote. The Prime Minister was concerned about the impact on mental health of the COVID pandemic, particularly children and adolescents. Well, Prime Minister, we listened to your advice and we are ever grateful for your support. Thanks to the great support of Deputy Minister Zoe Rapti, today I can announce the launch of the Pan-European Programme on quality of mental health services for children and adolescents. This will support all 53 countries in the WHO European region in strengthening the mental health services they offer to these groups. Actually, I was telling to Excellency Prime Minister in the elevator that I came from Istanbul, where we build a new vision on health for migrants and refugees with political leaders, UN, migrant communities, all over the 3 continents. And for the first time, 3 region directors, European region, African region, Middle East. I announced what we're going to launch today, and I can tell you there is interest from the other regions as well. So the ambitions are high. It will support countries as they recover from the COVID pandemic. It will help them mitigate and reduce the long-term damage this pandemic has done to mental health. My friends, it is a shocking fact, but in 2015, there were over 4,000 suicides among the 10 to 19-year-olds in our region. Suicide is the leading cause of death in this age group in the low and middle income countries in our region, and the second leading cause in this group in high income countries. Ensuring that all children and adolescents in our region have access to quality mental health service is a moral imperative. These are life-saving services every bit as much as childhood vaccination or pediatric care. And when we talk about universal health coverage, quality of care must always be part of the conversation. If healthcare is bad quality, it can be dangerous. There is no universal health coverage without quality. Two sides of the same coin. Your Excellency, Mr. Prime Minister, honorable ministers, dear colleagues, providing high-quality mental health service to children and adolescents is not just the right thing to do, it is a wise investment. 50% of all mental health problems in adulthood have their onset during or before adolescence. Preventing and limiting mental health problems in today's youngsters will lead to better mental health in adulthood. As Hippocrates said 2,500 years ago, Kathe nossos ξεκινάει από την ψυχή. Every disease starts from the soul. So we too have united our forces to strengthen exactly what everything begins from. Our mental health and well-being, especially for our children and adolescents, who form the catalyst of hope for the future of our planet and generations to come. I thank you once again for your invaluable support. Ευχαριστώ πολύ.
Thank you very much, Regional Director Dr. Hans Kluge, and over to Natasha.
And now it is my honor and pleasure, Prime Minister, Mr. Kyriakos Mitsotakis, to take the floor.
Dr. Kluge, ministers, ladies and gentlemen, today, dear Hans, I'm particularly happy for three reasons. The first is that I'm back at work after having spent a week in isolation at home with minimal symptoms. I can assure you from personal experience that vaccines do work and that they do keep us safe and that they prevent us from getting seriously sick from a virus that continues to be particularly dangerous. And it is indeed fitting that my first public event is coinciding with this very important day for the WHO. It's regional presence in Europe, very important day for Greece and for our healthcare team. I mean, the official opening of the WHO regional office on quality of care. I would like to take this opportunity to thank all those who contributed towards making this a reality, starting from Minister Georgiadis, who first established this relationship with the WHO back in 2013 during very difficult times. Minister Kikilias, Minister Plebris, alternate Minister Gaga, Deputy Minister Rapti, our Secretary Generals who are with us here, Dr. Theodorakis. Is a very important day for Greece, and I'm sure that, dear Hans, you would not have been here as WHO if you were not convinced about our vision, not just to support this office, but to implement the best practices as they are being produced by your wonderful team of experts. As we emerge from the pandemic, we have an obligation to Greek citizens to further strengthen our national healthcare system, to make it more resilient, and to make sure that we place a particular emphasis on quality of care. You know the work we've done in terms of setting up a specialized organization to measure quality of care. And I do want to stress the word measure because what cannot be measured cannot be properly evaluated and hence cannot be properly improved. The pandemic highlighted the strengths, but also the weaknesses of our national health system. I want to pay tribute to the phenomenal work that was done by all our healthcare professionals during particularly difficult times. We all struggled over 2 years with an unknown enemy, and we're not completely done yet. And we need to think about living with COVID in the long term, what this will mean for our vaccination policies come the fall. What does this mean in terms of our basic precautions? But COVID also highlighted the fact that unfortunately in Greece, and we have to be very honest here, the quality of healthcare unfortunately is not equitable. And that is one of my main concerns. I want to make sure that in Greece, regardless of where you live, regardless of whether you have access to a regional hospital or a top university hospital in one of our big cities, that we have uniform standards regarding quality of care. And this, of course, means that we look at healthcare as a continuum, starting from public health and prevention, moving to primary care, where we are initiating a very important reform. Looking again at the way our hospitals function and look at post-hospital care. We have very, very ambitious goals, and we want you to be partners in this effort. We are big believers, as I told you, in evidence-based public policy. And we're here to break down silos, vested interests, and all those who do not look at healthcare from the perspective of the end user. And the end user is a citizen who deserves better healthcare, especially in this complicated post-pandemic world. And of course, the third reason why I'm very happy is because you took note of what I told you in our meeting, and you are launching here a regional program, which I'm sure will be expanded also beyond the European region, regarding best practices for mental health for children and adolescents. This is an area I deeply care about. Children and adolescents are the most vulnerable parts of our society. We do not talk enough in Greece about mental health in general. We talk even less so when it comes to the mental health of our children and of our teenagers. We need to break down these stigmas, these taboos, and make sure that in this very difficult and complicated world where we face challenges from bullying to eating disorders, to issues of identification, to this, our teenagers living in this parallel world of, physical world and the virtual world, that we adapt our mental services to make sure that we offer children and teenagers the best possible quality when it comes to mental health. So thank you for taking note of this recommendation. I'll be following the progress that you make on this front with great interest. And of course, the ministry knows that it has my full support when it comes to developing innovative policies regarding mental health for the Greek national health system. So let me again congratulate all those who have been involved in setting up this office. Wish you best of luck. Make sure that this is an office that is creative, but also I'm sure that your team will enjoy being in Greece. I wish you, a lot of creative policy making that will benefit not just Greece, but the region, and why not the whole world. It'd be great if this work starts out of Greece. Thank you very much.
Thank you very much. And it's now time to proceed to the signature ceremony. And I would like to invite again, Your Excellency, the Prime Minister, to oversee the ceremony, Minister Plebris and the Regional Director, Dr. Kluge, to come to the podium. So, and we will first start with Minister Plebris. And Regional Director. And one more. Thank you, Dr. Theodorakis. One more. One more, please. So if I can ask you to come perhaps in front of the podium and hold a copy each.
Okay, I'll take my copy.
And now I would like to invite Dr. Breda to hand a small token that we have also for...
Not for the men, I'm sorry. Please.
Thank you.
And
This part was not in my script, but thank you to everyone. And now I would like to ask Your Excellency the Prime Minister, the Minister, and Dr. Kluge to follow Dr. Breda so that we can have the official opening symbolically. Thank you very much.
thank you.
We are ready. So, honorable ministers, dear regional director, ladies and gentlemen, welcome back from our short tour and signature ceremony. Following the opening addresses by our high-level representatives, we will now move forward to hear the keynote addresses of renowned experts as well as the Deputy Minister of the Hellenic Republic responsible for mental health, Dr. Ms. Zoe Rapti. I would like to invite Ms. Rapti to the podium. The floor is yours.
Honorable Regional Director for Europe, Dr. Hans Kluge, dear ministers, dear colleagues and friends, ladies and gentlemen. It is an honor and a privilege for me, as Deputy Minister of Health of the Hellenic Republic, to stand before you this afternoon and to be able to present you with our new WHO European Programme on the Quality of Mental Health Service for Children and Adolescents. This programme represents a pivotal policy reform and a tremendous joint initiative between the Greek government and WHO Europe, with direct outcomes for the benefit of Greece and all 53 countries of the WHO European region. I would also like to extend my sincere gratitude for the continuous support and commitment demonstrated by our Prime Minister Kyriakos Mitsotakis and, of course, WHO Regional Director for Europe, Dr. Hans Kluge, for his dedication and guidance in making the vision a reality. In my post as Deputy Minister of Health since August 2020, I have been tasked with what I consider to be the most critical of issues, one that will be overlooked no more in health policies, agendas across Europe, that of mental health. As we all know, health is not merely the absence of disease, but it is the physical, mental, and social state of well-being of an individual, and by extension of our societies and communities. Our health has been put under constant strain throughout these past 2 years as we battled recurrent waves of the COVID-19 pandemic. Yet, no single aspect of health faced greater burden than our mental state. This burden is too heavy for one to carry alone. And it is our responsibility as policymakers, as government representatives, to ensure that no person is left without support, no person in our society feels helpless. It would not be sufficient to talk about the burden of declining mental health on individuals without focusing on those who are most vulnerable, those who need it the most. We are, of course, talking about children and adolescents who often bear the brunt of such mental health burden, a fact exacerbated by the COVID-19 crisis. The youngest populations faced immense disruption in their everyday activities, including socialization and education. Many countries in the region and across the world observed increased anxiety, depression, and withdrawal among this age group, as well as an increase on online addictive behaviors, poor concentration, and a detachment from daily obligations and activities. I am thankful, therefore, that even from an early stage of the pandemic, our Prime Minister Kyriakos Mitsotakis foresaw the great need to shift our focus on the improvement of our younger population's mental health resilience. And this is the moment where I can proudly present the fruit of our joint efforts with WHO Europe, a pan-European program that aims to provide long-term protection for the mental health of children and adolescents, with a distinct focus on adapting international good practices, on integrating innovative solutions, and on leading by example. In Greece alone, we conducted a joint review initiated by the Greek government in collaboration with WHO Europe as a first step to identify the gaps in the provision of mental health services nationally. This allowed us to map the current state of mental health services in our country and to ensure that our proposed actions are both targeted and effective. The review found important deficits in the infrastructure and available programs regarding the provision of mental health services to our population. This led to the creation of the National Mental Health Committee that has now been tasked with the development of our National Mental Health Action Plan for the next decade, taking into consideration the lessons learned from the pandemic and the distinct needs of each target group. Yet, the situation is far from different in other countries in the region. This is why the WHO European Programme on the Quality of Mental Health Services for Children and Adolescents is set to make an invaluable contribution to the region to enable the creation of mutual learning networks between mental health professionals across the borders and to set solid quality standards and guidelines for the application, implementation, and monitoring of mental health care for children and adolescents at a pan-European scale. Childhood and adolescence are critical stages of life for the development of positive mental health. Rapid change, growth, and development allows for the acquisition of cognitive and social skills that are important not only for quality of life, but in order to build the necessary tools for adulthood. Investing in the mental health of our children means investing in the future of our societies. This WHO European Programme will do exactly that by first supporting innovation in the quality of care in the field, second, by enabling concrete policy analysis in the field by focusing on country case studies and systematic literature reviews, and third, working on capacity building across the spectrum of children and adolescent mental health quality by developing modules to be systematically delivered through training and specific tools to measure clinical progress. Our vision is to create a program that is not only impactful and innovative, but that can be measured and adapted to the different national contexts the program will serve. I cannot overstate how proud I am for all the work that has been put into the conception and delivery of this program, and for our country serving as the host of such a center of excellence. This will play a significant role in enabling the practical application of these policies across not only the Mediterranean basin, but across Europe as a whole. Thank you very much for your support. This is only the beginning.
Thank you very much, Dr. Rapti, for your keynote, which is really setting the stage for our collaboration and for moving forward. I would now like to invite my colleague, Dr. Lydia Lasseri, to take the dais here and to address us. She is the Regional Advisor for Mental Health in the Regional Office in Copenhagen. Please.
Thank you, Dr. Weber. Good morning. Good morning, Regional Director. Good morning, Deputy Minister Rapti. Good morning, Alternate Minister Dr. Gaga. Dear Dr. Hadzapardi Muscat. Good morning, dear colleagues. I think another moment that we are making history here is to realize that this is the first time in my life with WHO, dear Regional Director, in the 22 years since I'm with WHO, that we have the same Prime Minister and the same Regional Director coming to talk about mental health in less than a year. This has set a record that I don't think it will be beaten in the years to come, because it shows a very unprecedented and unique commitment to mental health that is indeed that paved the way for where we are today. I think we started with a wonderful milestone, and it was mentioned, the Athens Summit for Mental Health, and it has made us all proud when the outcome statement of the Athens Summit and the works that we did that and the call that was issued by both Prime Minister Mitsotakis and our regional director to member states has been echoed over and over again in all the global and European mental health events. So it gives us pride that in WHO Europe we have now this strong impact among the countries. The Athens Summit focused on the lessons learned and how to address the impacts of COVID-19 to mental health. And as you may remember, one of the groups that were most vulnerable during the pandemic of COVID-19 was children and adolescents, for a number of reasons that are mentioned in the reports and in the outcome statement. And to address this need, we have now the program of quality of care for mental health of children and adolescents. Why is that? Because we realize that there is a lot going on in Europe, but there is no standard guidelines and standard frameworks that can equalize, and in the words of the Prime Minister, that can bring equitable, accessible, affordable, and quality mental health services across Europe. And the milestone that we are marking here today is indeed gives us more responsibility, and it's to the level of being also humbled by the responsibility and the trust that is bestowed on us. And just to tell both our regional director, Deputy Minister Rapti, Minister Alternate Gaga, we are starting to work from tomorrow. We are not waiting for next month or the month after when we have the meeting of the coalition. Tomorrow we'll have a meeting here in Athens, an informal meeting with colleagues, with child and adolescent mental health experts for all over Europe, including Greece, where we'll start mapping what it is in Europe, what are the programs existing, what are the tools. We will introduce a tool later this afternoon, and how we go ahead, so that about 6 months from now, after summer, we can again enjoy the Greek hospitality and come with a European level meeting for discussing what we will have developed as a working package for children and adolescent mental health care. With this, I'm very thankful, humbled, honored to have been today, and I can only promise you that the team we have in WHO Europe will do the best to live up to the expectation that is being set here. Thank you.
So much our regional advisor for mental health, Dr. Lydia Lashley, my good friend Lydia, for your really very important notes, and most importantly that we start not from tomorrow but from this year. Actually, we have started many months ago. And I would like now to ask the director of our CPS department, Country Policy and Support, Dr. Natasha Zopati-Muscat, for her closing remarks.
Thank you very much, dear Pavlos, dear Martin, Regional Director, Deputy Minister, Alternate Minister. It falls to me to actually start by thanking the wonderful team that we have established over here in Athens. It is a team made up of a small core team which is growing by the day under Dr. João Breda's leadership, but it is also a much larger team because it is part of the division working in close collaboration with all our units in Copenhagen, in Almaty, in Barcelona, and also in Venice. And I think this is the beauty that we are weaving together. Dr. Martin Weber, who has joined the team as the lead on quality of care, is also a former regional advisor for child and adolescent health, and still actually our focal point for child and adolescent health in the region. And therefore, I really see that we are building a synergy, putting quality of care at the center, but identifying in a very agile way where it is that we want to have an enhanced focus. And I commit, as I committed to you, Deputy Minister Rapti, already last September, that the mental health of children and adolescents is going to be a priority area of work across our division under the mental health flagship as one of the 6 pillars of work that is being taken forward through the coalition, and as one of the priority areas being taken forward by the Quality of Care Office in Greece. And I stand here optimistic and confident that we are really going to be able to make a significant impact for our countries in the region, starting also to show results very soon. And now it's only to thank the technical staff also who have been supporting our excellent and very high quality event this morning. Thank you very much for being there, and to invite you all to join us in a healthy Mediterranean snack and to continue the conversations. Thank you.